What are, at a high level, some of the treatment options that are available for small cell lung cancer?
For decades, chemotherapy has ruled small cell lung cancer for better or worse. This is, in the United States, for the most part, a combination of two classes of drugs, platinum and etoposide. And these are the backbone of essentially everything we do for newly diagnosed small cell patients, regardless of stage. And for many years was virtually the only thing that we could do for patients that had small cell lung cancer. There are other chemotherapies that are deployed perhaps in later line settings or for patients that may not be, for whatever reason, eligible or tolerant of some of those, but much less successfully when they're deployed. Recently, the treatment options have evolved in a beneficial way. And so we've seen the addition of immunotherapy, immune checkpoint inhibitors to our small cell lung cancer regimens. And we've also seen just more recently the inclusion of a relatively novel class of agents called T cell engagers or bispecific T cell engager in this case. I think we can talk about later, and a really fascinating mechanism of action and something that brings a lot of optimism to the field. Still, chemotherapy is doing a lot of the heavy lifting in this disease, but finally we're finding ways to engage the immune system. And then something that's not quite ready for prime time in the sense that it's not approved yet in small cell lung cancer, but I think deserves some attention, which we'll probably give it later, are a unique class of chemotherapy delivery agents called antibody drug conjugates or ADCs. And again, I think a really creative and novel way of treating cancers, moving away from the chemotherapy that just kills anything that moves to something that feels a little bit more personalized, a little bit more specific in treating the tumor.
So I'll be brave if you're brave. I'll be brave, but only